I'm Dr. Sumit Periwal, pediatrician from Gangtok, Sikkim. I faced violence. I remember that night very well. We were shifting sick critical child from BM Birla to Narayan Vidyalaya, and we just put the child in the ambulance when suddenly the driver said that we are being surrounded. I got a call from the management. Whatever happens, do not get out. Don't open the gates. The next 1 hour was the most troubling hour. The pain, the fear, the hurt, and the uncertainty what will happen if the gate is broken open by the mob. It was terrifying. But the management worked hard, police came, the mob was dispersed, and we were taken in. But the entire night we were afraid that the mob may come back again and attack the hospital or attack us.
This is the voice of one of the many doctors who have faced assault by people in the line of their duty. Since the onset of the coronavirus pandemic, such assaults have come into sharp focus, with doctors, nurses, and other frontline healthcare personnel being frequently assaulted as they try reaching out to people on the ground. Hey everyone, welcome to Change Begins, a weekly people-centric podcast with me, Mahim, where we feature stories of change driven by citizens, along with expert voices who shed light on the issue at hand. Today we'll be discussing the central government's latest ordinance aimed at protecting doctors and healthcare professionals against the brutal attacks that they've been subjected to amid the coronavirus pandemic. The ordinance basically amends the Epidemic Diseases Act 1897 and brings in penal provisions for those who are found guilty of carrying out attacks against doctors and frontline healthcare professionals. During the course of our discussion, we'll be joined by Dr. Sarika, who started a petition on change.org asking the government to bring in a law to stop these assaults against doctors and healthcare workers. Also joining us will be the Indian Express's Deputy Associate Editor Abantika Ghosh. A well-known health journalist, Abantika has been covering the COVID pandemic comprehensively since its outbreak in India. So what does the amendment mean for those who are found guilty of assaulting doctors and other healthcare personnel? First, it provides for an imprisonment of 3 months to 5 years, along with a fine of 50,000 to 2 lakh rupees. Second, if the assault is of a more severe nature, and if the attackers end up causing grievous hurt, the jail term would go up from 6 months to 7 years, and the fines from 1 lakh to 5 lakh rupees. And third, we've seen a lot of cases where these assaults end up damaging the property of the doctors or healthcare professionals involved. The government also seeks to address that. So if the attackers cause damage to the healthcare workers' property, they would have to pay compensation to the victim, which would be twice the market value of the damaged property. Now, without a doubt, the ordinance addresses a crucial issue. According to the Indian Medical Association, up to 75% of doctors in India have faced some kind of physical or verbal abuse at work. Most of which comes from relatives of patients, unknown sympathetic individuals, bystanders, or even politicians. With incidents of violence against them rising, over 8 lakh doctors across India were pushed to go on a strike last year in June, demanding safer working conditions. Let's start with Dr. Sarika, who says the recurring incidents of doctors being assaulted even as they risk their lives in the line of duty hurt her deeply. And on the night of April 1st, she decided it was time to initiate change. In just about 2 months, Dr. Sarika's petition on change.org received overwhelming support, garnering over 2 lakh signatures in a very short time.
Violence against the medical profession is something that we face very routinely. But when the COVID-19 pandemic started and the first thing that the Prime Minister made everybody do was clap for their COVID warriors, I thought it would be better. But when I saw that doctors continued to be attacked, first evicted from their houses, and then the Hyderabad episode where the doctors in Gandhi Hospital were hit, it really hurt something within me, and I thought maybe that it's right time to ask for this offence to become a non-bailable offence. And that's when I started this petition on 1st April night.
So as we see, Dr. Sarika, your initiative for change, your decision to do something about the issue comes from a personal experience. But do you think, as a doctor, that this ordinance will be an effective deterrent?
I do hope that this ordinance will act as a deterrent because right now the COVID warriors are in the forefront, and if anybody hits a doctor or a medical worker or a police person, I do hope that the government will come down on them very strongly and show them that they are serious about it.
Thank you so much for joining us, Dr. Sarika. Let's now go over to Abantika, who has seen the response of the government as well as of the community to the pandemic while covering the issue from close quarters. So, Abantika, the medical community seems to have received the centre's ordinance quite well. Do you think this would be enough to address the issue?
Yes, I think this will be a bit of a deterrent, at least, if it's publicized properly. But also there's a lot of fear in the community that too needs to be addressed. Policing may not always be the solution for everything. There's a lot of work that needs to be done.
There is a lot of fear in the community, the healthcare community, and that needs to be addressed as well, because only policing isn't going to fix the issue. There is a lot of attitude change that's required. So that is what Abantika thinks. Now also, Abantika, there are a lot of voices that are calling for increased government spending on health, especially towards infrastructure and staffing. And that's something, it's being said, would address the root cause of the problem.
Not in the current scenario, because normally when we hear about doctors being assaulted, that's in a different setup in hospitals when people think they have not been attentive enough. There are apprehensions and suspicions of medical negligence. But here this is a different situation. Here doctors are being attacked because there is this sense, there is somehow this message is found that this disease is so infectious, and even if somebody is not showing symptoms, it's the fact that this person has come in contact with the patient, it's possible that he is not showing symptoms, that he passed it to you. For example, the Chennai doctor who was not allowed a recent burial, this was a dead body. It was not a case of assault on medical professionals the way we normally in non-COVID times know it. It's a different situation.
So that was Abantika saying that the situation in which doctors get assaulted during non-COVID times is different than what we are seeing is happening now, owing to the fear of the virus itself. As of now, the medical community and the people at large really do hope that these renewed penal provisions and the fear of prosecution would really go a long way in preventing people from assaulting doctors and healthcare workers who are on the front lines of the nation's battle against the coronavirus pandemic. So that's all that we have for you in this episode of Change Begins. Log on to our website to check out the range of issues that we are working on. You can also find us on Facebook, Twitter, Instagram and YouTube. If you have any comments or suggestions, do write to us. That's all for now. Thank you for listening.